Fast forward 2 years later, Ghana has recorded no critical or severe COVID-19 cases at the ICUs in the last 1 month. The feat comes, of course, as Ghana marks 2 years of the fight against the pandemic. My colleague Sarah Pencroff visited the Infectious Diseases Center and reports the last patient was discharged on February 29.
2 years ago, when Ghana was fighting the COVID-19 disease, the intensive care unit of the Infectious Disease Center was filled to capacity with patients who were critically or severely ill from the disease. The situation has, however, not been the same over the last 1 month. The usual busy movement by healthcare workers was missing. This is the ICU monitoring room, where patients are monitored on 24-hour surveillance. But there are no patients to be monitored. Only 3 out of the 16 regions currently have active cases, of which most are being managed at home. This is the ICU room 1. It is a 6-bed capacity and just one of the various rooms set aside to attend to critical and severely ill patients of COVID-19. I'm informed as at January 29, the last patient was discharged. There haven't been any admission here nor across the country of patients who have been critical or severely ill from the COVID-19 disease.
For most facilities that are doing COVID ICU in our country, majority of us have not had any patient for almost a month now on admission. There's the odd patients who in 1 or 2 places, but we run a COVID OPD for those who test positive but who are not ill enough to require admission, and we run a post-COVID OPD.
Healthcare workers at the center are now relieved of the stress.
You have to come to work and you are scared of losing your patient, but now I come and see the place empty. But the issue is I'm quite afraid. Are people really not sick, or they are hiding in their homes?
The normal may never come back. So how are we handling that? That is what scares me.
We've wept over patients that we've lost, and it's not a very nice feeling to experience that over and over again. And like my other colleagues have said, you are coming to work and you are thinking, is this the day I also become a critical care patient?
If you are doing something and the results you want are coming out, you are glad. But we are also scared because we don't know the level at which we've gotten to exactly.
We are glad that COVID is going down, but then we still want to think about the future. What happens? How prepared are we for such occurrences?
Drastic decisions were taken. Livelihoods have been lost. The socio-economic effects have been grave on economies. But how did we get here as a country?
So far, I don't think we regret any decision that we've taken. Anywhere you go, everybody thinks that Ghana has done very well in the programs and plans we put in place. Lockdown is a very difficult thing to do. And that was a very difficult thing, a very difficult decision, for example, for His Excellency the President to take. But we have to.
According to government, finance was the major challenge encountered during the fight, and lessons have equally been learned.
Never again shall we be caught unawares like this. The government has spent millions of Ghana cedis to make sure that it happens. And once you take this money to do these things, you have to get money to do other things. Unfortunately or fortunately for us, I think we have some decrease in some of the activities. We didn't reach some of the targets.
The cases are declining. It appears people are no longer getting critically or severely ill of COVID-19 infections, perhaps as a result of the vaccine uptake. But healthcare workers remain skeptic on the way forward as a country. Sarah Pencroff, TV3 News, Infectious Disease Center, Ghana East.
Wow, how time flies. It's been 2 years already. Aisha, so there you have it. 2 years on, I remember that press conference that the health minister addressed at about 10 p.m. that night, and we're all on the edges of our seats.
All of us.
And 2 years on, let me just give you an update of how the situation looks like. It appears with everything that's happening in the country, we seem to have taken our eyes off the ball. But COVID is still around, and this is how the picture looks like right now. According to the Ghana Health Service, 14 new cases as at March 10, 2022, active cases 192. We had 1,145 people who are dead as a result of COVID. These are not just statistics. They are human beings, relatives behind these statistics. So these are 1,445 people who have died as a result of COVID-19 over the last 2 years to date. Now, we have 509,044 recoveries and discharges, and the total of 160,681 case count as we speak. This is as at March 10, 2022. Now, take a look at this. According to the Ghana Health Service's own statistics, the vaccines that have been received, Ghana has received over the period, is a little over 27 million. So 27,413,400 vaccines, all 5 types of vaccines we've received. And a number of vaccines that have been administered out of the 27 million is 12,744,162 of the vaccines have been administered. Only Johnson & Johnson bought by government. All others were donated, and that's according to the Ghana Health Service. Now, if you look at the interventions so far in terms of the policies that government introduced over the period, according to the budget, 2021 budget, the total money spent to feed Ghanaians during the COVID period, as announced by the then majority leader who presented the 2021 budget because the finance minister was ill at the time, 54.3 million Ghana cedis was spent in feeding Ghanaians, if you recall, during that period of the lockdown. Then the families that received this, about 470,000 and over 600 million coronavirus alleviation program and business support scheme, which was administered by the National Board for Small-Scale Industries, now the Ghana Enterprise Agency, as we speak. 600 million stimulus package that was given for social interventions. Also, the unfortunate heroes who we have lost as a result of COVID. Now, the statistics are quite worrying, but these are human beings. The doctors who were infected by COVID-19, 544 doctors were diagnosed with COVID-19. Out of that, 9 died. We had 4 consultants, 2 specialists, general practitioners, critically ill, 50 of them, and then we have some 6,700 nurses who were also infected. And out of that, 9 unfortunately died. This is according to the Ghana Medical Association and the Ghana Registered Nurses and Midwives Association, who also gave us this statistics. So it doesn't really look good as we speak. But the good thing is that the situation has been brought under control, Aisha, and we all have to adhere to the protocol.